Hello everyone. In this class, we'll try to learn about abnormal respiration. Some of the conditions are asphyxia, hypercapnia. Hypocapnia are some abnormal respiratory condition. Asphyxia is a condition in which hypoxia is combined with hypercapnia. Usually, asphyxia develops due to mechanical obstruction of airway as occurs in suffocation, strangulation, drowning, foreign body impaction in the trachea or larynx, and traumatic compression of the chest. So, there are different stages of asphyxia. There are three stages. The initial stage is stage of exaggerated breathing, second is stage of convulsion, and third is stage of exhaustion or collapse. Hypercapnia is nothing but it is the retention of carbon dioxide in the body. Carbon dioxide is a major product of metabolism. Therefore, conditions of hypermetabolic states such as fever and excess carbohydrate intake generally produce hypercapnia. Hypercapnia is common in conditions of hypoventilation in which either the ventilation is depressed as it is seen in respiratory failure, brain injury or narcotic poisoning and etc. Or the ventilation is inadequate as it occurs in myocardial failure, polyneuropathies, the disease of the chest wall, etc. Hypercapnia is usually does not occur in pulmonary fibrosis as carbon dioxide is more soluble than oxygen. However, severe destruction or thickening of alveolar capillary membrane as seen in emphysema or fibrosis can directly impair gas exchange and produce hypercapnia and hypoxia. Hypoxia with normocapnia is termed as type 1 respiratory failure, and hypoxia with hypercapnia is called as type 2 respiratory failure. In fever, with a rise in body temperature by 1 degree Celsius, carbon dioxide production increases by 13%. However, respiration is also stimulated in fever and excess of carbon dioxide is removed from the body. Therefore, if the ventilation is compromised in such situation, carbon dioxide accumulates in the body and hypercapnia results. In a high carbohydrate intake, production of carbon dioxide is increased due to the increase in the respiratory quotient. Effects of hypercapnia. Hypercapnia stimulates respiration. However, if severe and prolonged, hypercapnia leads to respiratory depression. Finally, this leads to coma and respiratory depression that further increases the level of carbon dioxide. Profound hypercapnia produces respiratory acidosis, during which plasma bicarbonate may exceed more than 40 milliequivalents per liter. This occurs as bicarbonate reabsorption from kidney tubule becomes more than its excretion. So that increases the plasma bicarb and tries to compensate acidosis to some extent. Hypocapnia. Hypocapnia is carbon dioxide washout from the body that results from hyperventilation. As hyperventilation increases oxygen intake, there is a simultaneous increases in the partial pressure of oxygen. Temporary hyperventilation occurs on sudden exposure to hot environment. Hyperventilation is more common in neurotic patients. Another example is voluntary hyperventilation performed for experiments in which considerable hypocapnia, that is PCO2, may fall as low as 15 mm of Hg and is associated with significant increase in PO2 in arterial blood, which may rise up to 140 mm Hg. Hypocapnia produces vasoconstriction and reduces the cerebral blood flow by more than 30%. Cerebral ischemia may cause dizziness, lightheadedness, and sensory abnormalities mainly in the form of paresthesia. Hypocapnia causes depression of vasomotor and respiratory centers. Cardiac output is decreased due to the decreased coronary blood flow. Features may also occur due to associated respiratory alkalosis that results from hyperventilation. Plasma bicarbonate level is reduced. However, due to inhibition of secretion of acid in the renal tubule, HCO3 absorption is decreased. Features of Calcemic tetany, such as Chostek sign and carpopedal spasm, may develop due to the decreased ionic calcium levels. Drowning is suffocation which is caused by immersion in water. In freshwater drowning, water enters the lung, and from the lungs, water is rapidly transferred to the blood, causing faster hemodilution and hemolysis. In seawater drowning, hypertonic water in the lungs draws the fluid from vascular space into the lung that causes hemoconcentration. However, in few cases of drowning, first grasp of water into the respiratory tract causes immediate reflex laryngospasm and water does not enter the lungs. The patient dies of asphyxia. Respiratory acidosis. Any condition that decreases the removal of carbon dioxide from body through lungs causes increase in partial pressure of carbon dioxide. This leads to respiratory acidosis. Depression of respiratory centers as produced by narcotics and barbiturates causes respiratory acidosis. Diseases that affect respiratory apparatus like chronic obstructive lung diseases, pneumothorax, pleural effusion, chest wall deformities, and diseases that impair diffusion of gases through alveolar capillary membrane like pulmonary fibrosis, pulmonary edema can also produce respiratory acidosis. The increase in PCO2 stimulates respiratory centers and increase the rate and depth of respiration provided the primary defect is not respiratory center. So elimination of carbon dioxide through the lung restores the blood pH. Respiratory alkalosis. The basic cause of respiratory alkalosis is excess elimination of acid via respiratory tract. The decrease in H plus ion concentration is due to the hyperventilation that decreases partial pressure of carbon dioxide. A physiological cause of respiratory alkalosis is uh, ascent into the high altitude. Coming to abnormal respiration, periodic breathing. The cyclical repetition of apnea and shallow breathing, like hyperapnea, in normal individuals is called as periodic breathing. So this is typically seen following voluntary hyperventilation performed for at least 2 to 3 minutes. Apnea occurs due to the removal of carbon dioxide during hyperventilation that removes the carbon dioxide drive on ventilation. During the period of apnea, PCO2 accumulates and oxygen falls in the blood that stimulates ventilation via chemoreceptor stimulation. The elimination of hypoxic drive stops, so that leads to apnea, which again leads to accumulation of carbon dioxide and produces hyperventilation. Thus, the cycle of apnea hyperapnea continue till PCO2 gradually returns to normal. Okay, so this is uh, the normal breathing, and this is the chain stroke breathing, and this is Biot's breathing. The periodic breathing is abnormal condition called as Cheyne-Stokes respiration. Though it occurs in deep sleep in some normal persons, it is more common in congestive cardiac failure, uremia, and brain diseases. The patients have increased sensitivity to carbon dioxide due to disruption of neural pathways. Accumulation of carbon dioxide causes hyperventilation that lowers PCO2. Decreased PCO2 removes the carbon dioxide drive on ventilation and produces apnea, which consequently increases the PCO2 again. The causes for chain stroke breathing are it can occur in premature infants, unacclimatized person at high altitude, during deep sleep in some people, in heart failure and in renal failure. Other abnormal breathings are Kusmal's breathing. So the this is pattern of respiration seen in diabetic ketoacidosis, which is called as Kusmal's breathing. Accumulation of metabolic acids such as acetoacetic acid and beta hydroxybutyric acid produces metabolic acidosis that stimulates the respiratory center. This leads to rapid and deep inspiration or air hunger as described by Kusmal. Buyout respiration is the in this type of abnormal breathing, 3 to 4 cycles of normal respiration will be followed by abrupt onset of apnea. Before apnea, usually deep gasps occur. It is seen in meningitis, that is disease affecting the medulla of the brain, increased intracranial pressure, morphine poisoning, and damage to the brain stem. Sleep apnea syndrome uh, in deep in adult deep apnea syndrome, marked loss of tone of pharyngeal muscle occurs during REM sleep, causing obstruction of airway during inspiration. So this produces apnea. The person wakes up with breaths normally for sometimes and sleeps again to have another bout of apnea. Thus, repeated apnea occurs during sleep. These people develop morning headache and fatigue due to the frequent apnea in the night. The sleeplessness occurs during the day. Another condition, sudden infant death syndrome. It is believed to be a type of sleep apnea in premature infants. Loss of rhythmic activity of respiratory center leads to apnea in sleep and causes death of the infant. It is commonly seen in premature babies with cardiac arrhythmias, complicating uh, long QT syndrome. Hysteric hyperapnea. Spontaneous hyperapnea of sudden onset occurring in patients with hysteria. This results in washing out of carbon dioxide leading to alkalosis and convulsions. It is treated by allowing the patient to breathe into facial mask till he recovers. Ondankus, in some patients with a brain injury, lose their automatic control on breathing but retain voluntary breathing. Such patients require respiratory assistance intermittently. As depicted in German mythology, the unfaithful lover of Ondine, a water nymph, was cursed by a king of water nymphs that he will lack automatic breathing and will live till he breathes voluntarily. Ultimately, the disloyal lovers slept for a long period of sleeplessness and died as he lost the voluntary breathing. Thank you.